Well, now let's turn things over to 17's Karen Hua with a demonstration of the new public health dashboard.
Kern Public Health rolled out new graphics to present their information in a more visual manner. But how much new information is actually here? Before, all public health's updates looked like this: a map, a chart, and a list of numbers. Now,
it's an expanded visual and more meaningful presentation of COVID-19 data.
A revamp. In this chart, the blue bars count the new cases each day, so we can see the growth over time. The white line shows all the total cases we've ever had, so that's a line that will always go up. The green line shows active cases. It only counts people currently infectious, not people who are over the virus. To flatten the curve, public health is looking for the blue bars, or daily cases, to decrease. And they're looking for the green line to go down as more people recover.
What we hope to see is that the number of active cases will stabilize, then decrease, as this will be an indication that there are fewer people in our community with COVID-19.
This graph also illustrates a new way of counting. Before, positive cases were counted on the date a person got test results back. Now, positive cases are attributed to the date a person took the test.
Right now, we are not 100% sure that the daily new cases have gone down. As mentioned, with the specimen collection date, we will need a few days to see that there aren't pending tests.
In this case status chart, the green shows how many have recovered. The blue shows how many are isolated at home. And the pink shows how many are isolated in a hospital. And there's a small sliver of purple counting deaths. In this pie chart, you can compare the percentage of tests that have come back negative, green, versus positive, light blue. But the largest chunk of this pie is still pending tests, the dark blue. As for the age chart, the numbers are now in bar graphs, but there are still just 4 categories. No further breakdown of age range.
We hope this is another way to further identify that the majority of our cases have been among those in the 18 to 49 age group.
The map is the most unchanged. While there is a faint outline of major highways, the geographical regions still do not list the cities in each.
For areas where you may not know exactly where the zip code is, you can take a closer look.
Public Health will now update these numbers once a day instead of twice like before. But that means stats like the number hospitalized and the number recovered will be given daily instead of weekly. While this dashboard is a helpful visualization, some of the most pressing information wanted by the community, like gender, race, city, all of that is still not given.
We are hopeful that we are flattening the curve. It is unfortunately still too early to know.
To see all these graphics for yourself, you can visit kernpublichealth.com. In Bakersfield, Karen Hua, 17 News.